tutorial, we will be covering eligibility configuration and checking patients' eligibility. To access the configuration portion of eligibility, you will go to Navigate and Administration. You will then select Electronic File Services. Within the Electronic File Services, you will see the Eligibility option. To connect the insurances in your database to the appropriate insurance company to check eligibility, you will on the right select the insurance company that you would check eligibility through. I will select Aetna, and then I will click Add in the bottom right-hand corner. This will bring up a search engine to find the insurance company within your database. I will search by the insurance company, name. You can also do by in-house code if you know the insurance company's in-house code, or the billing type. You also can search by type, such as starts with and equals to. We will use contains. When I click Find, it will then display all the insurance companies that have not already been set up to check eligibility in your insurance database. You can select them by checking the box next to their name or select all. When you click OK, you will see a plus sign appear next to the insurance company. If you select the plus sign, it will expand and you will see the insurance companies attached to that insurance to check eligibility. If there's an insurance company that has been attached from your database to the insurance company incorrectly, you can check the box next to it and in the bottom right-hand corner, click Remove. The list you see here is the list of all insurance companies that Perfect Care is contracted with to check eligibility. You can also set up eligibility check directly in the insurance screen. To access the insurance screen, click Navigate. Again, in your administration folder, you will have reference data. Then select the insurance, and then find the insurance company. Double-click on it to open it, and then Details. Here under Eligibility Source, you will select the appropriate insurance company. That is how you set up an insurance company to check eligibility through Perfect Care. The next thing I'd like to show you is how to check eligibility for a patient. You can do this from two screens. The first screen is going to be the patient registration screen. In your Navigate, your Perfect Care EHR folder, you will select Patient Registration. You will bring up the patient that you want to check eligibility by searching for the patient, selecting them, and clicking OK. Here you see Blue Cross Blue Shield as the insurance. To check eligibility, I will go to the Patient Registration menu, and within it, click Check Eligibility. This will bring up a search engine. This search engine, you do need to have a provider number here. If a provider number is in the case information, it will automatically pull here into the insurance eligibility search engine. You also can change cases if you want to search eligibility for an insurance in a different case for this patient, and select between the two insurance companies. Also, if you're looking for eligibility for a day prior to today, you can select that date to see if they had coverage in June. Then you will click OK. This will bring back eligibility information. In this screen, it will give you the patient's most current name and address on file with the insurance company, which is good if you have patients that you have bad addresses on. It'll let you know when the plan began, if it's still active, and if it terminated, when it terminated. You have two options to look at. You have a summary view, which is going to give you basic information regarding the policy, such as copays and deductibles. The detailed view will give you additional detailed information, which breaks it down a little bit more by specialty and services. When reviewing eligibility and it's showing a deductible, it is going to show what part of the deductible is remaining, not how much has been met. And then it'll tell you percentage by 0.10, which means the patient is responsible for 10%. When scrolling to the very bottom of the screen, you sometimes will also see what if the patient has another insurance policy. It'll give you that information. The thing to remember with checking eligibility is that we do it through a third-party company, so the information that is returned to us is what has been provided to that clearinghouse from that insurance company, and we have no control over it here at NCG. You can print this information by right-clicking and printing. You can do a print preview, or you can also highlight, copy, and paste. The other location that you can check eligibility is in the appointment screen. If you click Navigate, Appointment, this will open the appointment screen. And you can check eligibility by right-clicking on the patient's name and check insurance eligibility, submit, and information will come up. The only thing with checking it from the registration screen, as you've seen, you cannot select a different insurance company. It's only going to check the insurance company that is primary and based on the case which the appointment was scheduled. So if the case is with the work comp accident, it's going to try to check eligibility for the primary insurance in the work comp case. You can also check eligibility by right-clicking on the provider's name and checking insurance eligibility. This will check eligibility for all patients that are set up and have insurance that Perfect Care will check eligibility for. When searching or checking eligibility for a group of appointments, it could take up to 48 hours for the information to return. Another way to check eligibility is under your appointment menu. By clicking the appointment menu, insurance eligibility, you can do it by patient, which is the same as right-clicking, or by schedule, which is right-clicking on the name or the top of the schedule. Also by schedule, you can do multiple schedules at one time. So if I want to check eligibility for everybody on the lab schedule and Dr. Anderson's schedule, I can select them both. And I can also expand the appointment dates. When I click OK, this will send out for all patients with insurances to check eligibility. And again, this could be up to a 48-hour process. When you check eligibility for a group, you will get this, that eligibility has been sent out to be checked, and an E will appear next to the patient's name. To get the status of a batch that you've checked eligibility, you will go to Insurance Eligibility and check Batch Status. You will then log in. Your NCG ID will automatically appear, and you will be assigned a password that you will be given. When you log in, you will see your status that you created for the batch that you sent. So the batch I sent on August 23rd at 4:05, this is where that information will come in. Once the information is available, you will see a button to click View. You can also change your dates here if you want to look at batches that you previously sent. And then click Search. They will be listed, and again, if they are ready, you will see View. You can also check eligibility history by patient by right-clicking and patient eligibility history. Again, your NCG ID number will automatically appear, and you will type in the password we have given you. And you will see each time you checked eligibility for this patient, the date and time. And when you click View, you will see exactly what you saw on that date and time that you checked eligibility. That way you do not have to print it and put it in the patient's chart. It will always be saved in their history. This concludes the tutorial on eligibility configuration and checking eligibility. If you have any questions, you can call the NCG support line at 1-800-330-1906 or email support@questions.@ncgmedical.com. Thank you for your time.